Hi, my name's Graeme Daniels again. I'm providing this follow-up to the video about problems with drug rehab, and call this one What to Look For in a Drug Rehab. I am the author of a book called Working Through Rehab, an inside look at adolescent drug treatment. I'm a psychotherapist. I've worked with individuals, kids, and adults for 20 years, spent 15 years working in the rehab business in hospital-based programs mostly. Once was the director of a group home. And I'm concerned with the state of this business and what it provides for individuals who are suffering with abuse, substance abuse, or chemical dependency, though I may use those terms interchangeably. So an overarching principle that I contest in the business is that of the keep coming back ethos, which is a term I'm co-opting from 12-step communities. Keep coming back is a slogan that is used to encourage suffering individuals to continue 12-step attendance, find sponsors to continue to fellowship despite the discouragement they may feel in their early recovery as they struggle with their addiction. But and what we want is for individuals, despite the slips, relapses, whatever, is to have enough faith in the process to, as they say, keep coming back and never believe that there isn't help available. However, in the business of rehab, keep coming back becomes a customer service chestnut that unfortunately has many individuals entering and re-entering programs year after year, in participating in multiple episodes of drug treatment over a lifetime. The division of the federal government, the Substance Abuse and Mental Health Services Administration, tracks admissions to over 13,000 programs per year and estimates that roughly 2 million, varies somewhat, but roughly 2 million per year admissions happen to such programs. Now notice I say admissions and not individuals, because it doesn't actually track how many admissions are repeat admissions, but that I can state anecdotally is the case. Too many people in this country enter into treatment multiple times in their lifetime without taking part in a decisive or comprehensive treatment episode, and that's my concern is to help change that through my book, through my website, through my practice, through periodic book readings, workshops, and so on. So the first specific principle to get into around what to look for in drug treatment is the principle of size. Size matters. Size of a caseload of individuals assigned to a counselor or psychotherapist, also interchangeable terms in the industry. Size of group activities. These group therapy is the dominant format in treatment of addictions. Strange, since it's not the dominant format for treatment of other mental health conditions, but it is the dominant format for treatment of addictions, partly because it's consistent with the 12-step fellowship ethos, but probably most importantly because it is deemed cost effective. But the problem is far too many programs across the nation treat the group therapy model in a cynical way and treat caseloads in a cynical way. Groups are stuffed with too many people. If you've ever been in a program and found yourself in a group therapy exercise and looking around a circle of somewhere between 10 to 20 people, you'll know what I'm talking about. If you've ever been assigned to a caseload with a case manager or therapist, again, whatever they're being called, and aware that you're one of a dozen people that person is working with and they don't have a whole lot of time for you, you'll know what I'm talking about. Look for programs where the caseload size is promised to be kept no more than a half dozen at one time, and that group therapy activities follow the standard of 8 participants per group. That idea of 8 participants has a long pedigree in the field of psychotherapy, as written about and talked about by people who practice that particular art. Okay, next, as a consumer of the product of drug rehab, if you're asking administrators, people who are in charge of admissions, ask them about the influence of so-called patients' rights or licensing bodies, state or local agencies that have a oversight function with respect to programs. Ostensibly, the purpose is accountability, but many overstep their mark. And in my experience over the years, their role was intrusive. Far too many counselors in programs across the nation spend far too much time sitting in front of computers, as I am now, writing rote documents, banal treatment plans, insipid progress notes, designed for the reading of technocrats, people who aren't even mental health professionals, for the purpose of oversight. At the risk of sounding like a political conservative, the regulation of mental health is not correct. I don't have a polite word for it. And so if you're checking out a program, try to find out what you can about the role of licensing bodies and patients' rights groups, and try to find out to what extent the program might be inhibited by such regulations or regulatory bodies. And if you're looking for another author who has opinions on this subject, Drew Pinsky, famous clinician, medical professional, wrote a book called Cracked in 2004, Life on the Edge in a Rehab. It's a good book. Check it out. Prescription of depth therapy. Now, prescription, I don't mean the prohibition of depth therapy. I don't mean that it is devalued in an explicit way, but made difficult. By depth therapy, I don't mean cognitive behavioral therapy. I don't mean anger management services. I don't even mean mindfulness training. I generally mean those therapies that are psychoanalytically oriented or derived, that aim at not just behavior or cognition, but at underlying thought and feeling states, the attachment patterns, the pervasive distortions of self and other. The long-term task of the recovering addict is not just to contain their using behavior or to learn 12-step principles. It is to get in touch with a broken self that does not understand how to organize an emotional life and needs help with that. And that requires an in-depth approach with a skilled clinician, and not enough of them are working in drug rehab. And those that are hamstrung, hands tied behind their back by the aforementioned machinery of programs and the influences of regulatory and funding sources. So it's important to, as a consumer, check out what is not just a theoretical approach, but how much time and space are individuals truly given by the professionals that will be working with them. Okay, lastly, a thought about adolescence and the marketing that is aimed at youth in programs. In 12-step, there is a phrase, fun in recovery, that is often invoked to give a sense of, lightness to those who may be struggling in early recovery. It it is particularly overused with respect to youth to entice them into drug treatment programs with the semi-lie that early recovery or abstinence from substances will be fun. It is not. While I'm all for providing recreational activities and programs, it should not come with the accompanying lie that early recovery will be fun. Healing from addiction is hard work, requires commitment over time. If somebody completes a 28 or 90-day treatment program or a 3-month program, or even a year-long program in a boarding school that is otherwise designed to, re-socialize an individual and completely alter their behavior, it should be followed up by an in-depth therapy episode. Sounds like a lot of hard work, I know, but it is better than going into rehab programs and coming back, 5 years later, going out, coming back 5 years later after that. And that's a story I've heard far too many times. And it's a story that I profile in my book, Working Through Rehab. And if you're interested in what I'm talking about, you might check out that book through my website, which is again called selfandaddiction.com, or you check out my blog essays if you want a shorter read. Graeme Daniels, Graeme is spelled Graeme, Daniels, .wordpress.com. Either way, regardless, thank you for checking out this video and listening to me talk about this subject for a bit.